Now, for over 20 years, the FDA has required mifepristone not only be given directly by the physician, but taken in front of a clinician as well to be able to assess for some potentially severe side effects. Well, after the overturning of Roe and some pressure from pro-abortion groups, the FDA has walked back on that. Last year, they said that the medication doesn't need to be taken in person anymore, but you still had to get it directly from a doctor after a thorough physical exam, an ultrasound, and some blood tests. Now they're saying you don't even need that anymore. You can actually just even do a telehealth visit, a quick 30-minute visit. You tell someone, oh, I'm pregnant, I'm less than 10 weeks, and you can get a prescription online, and you can actually go get the medication from a pharmacy or even a mail pharmacy if your state doesn't allow it. Now, I have some concerns about this, Ainsley. So first of all, if you take that medication after 10 weeks gestation, it can cause birth defects in the child. It may not cause an abortion, and you have a higher risk of a severe outcome. Now, the risk of taking mifepristone, it's about 5.2% of having an adverse event. 20% can be life-threatening. Now, while that is lower than some of our common medications, Tylenol, for example, has a very high adverse reaction event. The American College of Obstetrics and Gynecology say that about 50% of women don't actually know off the bat exactly how far along their pregnancy is. So my concern is women may take this medication, be greater than 10 weeks gestation, and put themselves at risk.
Wow.
Absolutely. So they could have what's called a failed abortion, and the baby itself, the pregnancy continue on, and the baby is at risk of having birth defects. So it could have a complicated pregnancy and complicated birth.
So are you recommending that women still, instead of the telehealth, go to your physician, go to your OBGYN, let them do a sonogram and see exactly the age of that child?
So if someone is considering medical abortion, I strongly encourage you to be under the direct care of a physician, of someone who's doing an ultrasound to confirm the gestation of that baby, make sure there's nothing wrong, and doing the appropriate physical examination. I think we need to stop cutting through the red tape, and politics need to stop inserting themselves into science, as that's what we're seeing here. They're taking away these safety barriers, and people are going to be harmed because of it.